In this TAC Tick Talk, Jacqueline and I caught up with influential and famous author Dr. Eric Kaplan to review his article, The Disc Dilemma, which he co-authored with Perry Bard and Jason Kaplan, both chiropractors as well. Listen on to hear what he had to say. Excuse the technical difficulties. We'll have to catch up with him again soon. All right, we're on right here with Dr. Eric Kaplan. Dr. Kaplan, thank you for joining Jacqueline and I. This is with our podcast, TAC Tick Talk. I don't know if you've seen these podcasts going around, but anyways, this is to provide ancillary content associated with these articles, Dr. Kaplan. So thank you for joining us. In the most recent issue, which is October, we are featuring the disc dilemma, right? In which you talk about decompression and how the most commonly injured segments are L4, L5, right? So my question for you is this something that you're actively treating, these disc injuries in your clinic? Or I know you have seminars that you're putting on. Can you just talk a little bit about your background, your educational formatting for students that want to be able to treat disc cases like you've been doing?
Well, Joe, I think disc cases are probably some of the most important cases that a chiropractor can treat, meaning a subluxation becomes a bulge and a bulge becomes a herniation. There is a progression to the subluxation that really hasn't really been identified. Now, James Cox was one of the first person within our profession that did it. But then Dr. Dyer, who's the Minister of Healthcare at the time for the country of Canada, he helped develop the first VAX-D. And then Norman Shealy, who was a Harvard neurosurgeon, he went ahead and worked with DRS and Acuspina. And basically, what you have is computerized mechanism of traction. But if you say, what's the difference, as Dr. Dyer said, who I was fortunate to be mentored by, he said, what's the difference between an X-ray and a CAT scan? A CAT scan is computerized radiography. Decompression is computerized spinal decompression. My background is very simple. I went to New York Chiropractic College. I graduated in 1978. I've been holding the first national certification program for spinal decompression. We've done it at Parker University. We've done it at National University. This year, we're doing it with Life University. It's a 12 CEU program. And for those doctors that want to work in treating of disc and disc-related injuries. And, Joe, it's a very funny thing because although that we know we treat the subluxation has 5 components. It has histopathology, it has neuropathology, it has kinesiopathology, it has myopathology, and pathophysiology. But histology, which is one of those 5 components, deals with tissue, which deals with the disc. So what we're trying to educate doctors of, not only how to read an X-ray, but also how to utilize the MRI. The MRI is not the enemy. The medical profession is not the enemy. The MRI actually is a friend and an ally because it helps diagnose disc injuries better than any other diagnostic tool.
Well, thank you for that clarification. Now, you mentioned that the MRI is not the enemy. Of course, it's going to provide us with more insight into what's going on. But you are a heavy critic of, say, lumbar spine fusion and surgeries associated with these types of injuries. So, recognizing that the medical profession is not the enemy, is there ever a time that it's okay, or what's your experience been with even cases that may have gone through, say, a lumbar spine fusion, had a negative outcome, still in pain? Are you able to treat those types of patients?
The answer, Joe, and I'm going to go into detail on that. Fortunately, I've been a chiropractic for a long time, not as long as your father, who actually is one of my heroes, but a long time. But basically, the question you're asking is a very, very good question in the sense that my son, Jason Kaplan, is a chiropractor. Actually, we're coming out with a book, Joe, which, I think we mentioned to Jackie, and we got our first edits back, and we're gonna really showcase it at the National Certification Program, which is this November 5th and 6th. And we're actually bringing in an orthopedic surgeon. We're bringing in a physiatrist. We're bringing in a radiologist. We're bringing in an anesthesiologist, bringing in a pain management person. So you're saying, hold on, Dr. Kaplan, what is all the medical people doing? Well, if you go online, doctors, you can look up failed back surgery syndrome. Failed back surgery syndrome is of epidemic proportion. More back surgeries are performed in our country than in most other countries. That's a problem. Now, what we do is I'm very big, Joe, on relating them to studies. So if you look at the Ramos and Martin study, if you look at the Ironman study, if you look at the Shealy Bergmeyer study, if you look at the Shealy Wasserman study, the Shealy Correlatia study, the Apfel study, the Leslie study from the Mayo Clinic. I mean, these are prestigious, and they're showing that spinal decompression, the Dennis McClure study, has a 92% success rate. Now, you asked the question about surgery. Surgery now only has a 50 to 60% success rate. So, Joe, think about this. Tiger Woods, one of the greatest golfers in the world, worth hundreds of millions of dollars. He's now had 5 back surgeries, 5. So it's not like he couldn't afford, Joe, the best doctors. It's not like he couldn't go to the best clinics. But they found in a recent study, the Deo study, is they found that every time a surgery is done, the success rate gets lower. So it goes from 50% to 30% to 15% to 5%. So, I mean, that's where the problem is. And our job as chiropractors is, understand, is working with the medical doctors, trying to show that we do have a solution, showing them the research from Harvard, from Mayo Clinic, the Palacio study from John Hopkins and Stanford, that we can show beyond a shadow of a doubt that spinal decompression does work. Norman Shealy, one of my mentors, said the first time he did a back surgery, Norman's a neurosurgeon, 500 published papers. He said he knew he had to find an alternative. And I'm lucky that, he blessed myself and Dr. Perry Bard, my partner of 35 years, because, I mean, what we're doing is trying to raise the image of the chiropractor to not fight the medical profession, but align ourselves with them, letting them know that we have a valuable asset. Meaning, if the story goes, Joe, chiropractic first, drug second, surgery last, why are we not following that paradigm? But America, most people, they follow drugs first, surgery second, and chiropractic last. 30% of my son's practice are post-surgical cases. This is serious, Joe, and we need to look at this in detail. And we as a profession need to increase our education, which is why we donate our time to Life University. And we're doing this program November 5th and 6th. Any doctors out there, contact Life University. I donate my time, as does Dr. Bard. And we're very grateful to the American Chiropractor. That's also been very gracious in their helping of Life University. Because, Joe, we got to increase the image of the chiropractor. I mean, what worse case can we get than a disc case? It's time for us to step forward.
I hear you. Well, no, that's a great message. Now, November 5th, 6th, the Trump Palm Beach Hotel, is that where it's at? Or
Trump actually doesn't have a hotel, Joe. It's a private country club. I'm hoping that your sister will attend and be our guest and join us for lunch.
All right.
It's not a hotel. It's a private country club, private membership, gated entrance. I always say, Joe, when people come into my office, I never asked them if they were Republican or Democrat. I asked if they were cash or check. And I've been very fortunate to have a relationship with the Trump family business-wise for over 25 years, professionally. And, so to me, I've been through all the stages, but I've worked also with Bill Clinton. Our job as chiropractors is not to take sides, not to get involved in politics. However, if we can help our profession, that's our job. So it'll be November 5th and 6th at Trump National in Jupiter, Florida. It's through Life University. It's a 100% fundraiser. It'll be the 10th anniversary, Joe, that we've done this. So it's a very successful, it was sold out the last 2 years running because it's a private club. They do have a limit, but it's very exciting. And we have some great material. The manual alone that they get is 250 pages. Plus, they get 12 CEUs.
Very good. And let me see here now. Every month, we've got you featured in the American Chiropractor with your monthly column. Let me see. I was going to say, in the latest article, you mentioned the importance of a thorough evaluation. What kind of information are we looking to verify for patients?
Jackie, I believe that, the D of the DC, or the
Mm-hmm.
D and the DR stands for detective.
Mm-hmm.
We as doctors have to be great detectives. There was a TV show I used to enjoy called House. And although that
Mm-hmm.
he was a very tough and maybe arrogant, even to some people obnoxious, but what he was a brilliant diagnostician. I found many times over the years, Jackie, working with chiropractors right now, I'm in 40 states, that
Mm-hmm.
chiropractors became a little weak in doing a full examination, a great diagnosis. And what we need to do is understand that if the patient comes into you with pain, are you good at what you do, doctors? Or are you great? Are you doing the best exam? Are you doing the best for the patient that you can? If your mother, your father, your sister, your
Mm-hmm.
brother, if they came to you, would you be
Mm-hmm.
able to give them the best diagnosis and the best treatment? I think that you can, but I think we need to go back to the basics. The basics are what makes us best. I meet with one of the big risk managers from NCMIC who handles the malpractice. And this is one of the two things that doctors are sued for malpractice. One of the two most common things, because doctors really don't know how to use DISC language. I mean, DISC has, DISC, we break it down as an acronym. DISC is DISC. DISC is specialized chiropractic. It takes chiropractic to a bigger level and a higher level. So November 5th and 6th at Trump National in Jupiter, Florida, we'll have the 10th certification program. It'll be a 12 CU program. There'll be breakfast each day. There'll be lunch on the Trump property. So here's what I'm telling you, doctors. You're not going to get this in a Zoom meeting. There's a 250-page manual. Will I do it again next year? Maybe. We have ongoing seminars in Florida that, for doctors and clients, but this we try to do to educate the masses on spinal decompression, because when they asked Willie Smith, why did he rob banks? He said, that's where the money is. And I changed that and I say, why do people treat discs? Because that's where the pain is. Where you have sciatica, you also could have neuropathy. So many chiropractors have moved away from the name of chiropractic. Everybody's a wellness center now. They're functional medicine centers, right? Now, okay, but those are pathophysiologies. I was schooled in an area similar to your father, who I said before, to your brother, one of my heroes, a great man of chiropractic who's really given back. And what you and your family have done, you should be acclaimed. It's the #1 magazine. Doctors, if you don't read it, the content by authors like Mark Student as well as myself are phenomenal. They're always bringing new content. The American Chiropractic is not just an advertorial magazine, it's an educational magazine that I think everybody needs to get their hands on, because that's why I continue to write for you, Jackie, and do stuff, because I consider you on the forefront of providing educational material in a visually and user friendly manner. And I think that's what chiropractors have to do. Just because you graduate chiropractic school doesn't make you a great doctor. It makes you a doctor. Remember, doctors, the enemy of great is good. You did good. You passed your boards. Now, can you treat the most difficult cases? If Tiger Woods came into your office, would you know how to handle that case? And would he choose you? That's the goal, doctors. Let's be the best that we can be. Let's take chiropractic to the next level. I can't do it alone, but be there November 5th and 6th. I promise you, you will walk away a better doctor. 12 CEUs and a full stomach later. What can I say?
Great. I love it. Well, you always do make me smile. So let me go on to the next question. Dr. Joe helped write up these questions for me. Are all decompression tables created the same? Some utilize a patient on their stomach, some require patients to be on their backs. How are these methods of application different?
Are all tables created the same? No, but Jackie, are all cars created the same? I think whatever vehicle you have, whatever table you have, it's your job as a doctor to master it. I think whatever table you have, whatever car you drive, I mean, listen, are you a good driver? Are you a bad driver? Your results dictate what it is. Now, there is a thing called an FDA 510K. Every table, whether it be a Chattanooga table, whether it be a Kennedy table, whether it be a DRX, whether it be an Acuspina, they will have a doc table, they will have an FDA 510K. In the FDA 510K, it'll explain what usages are, it'll explain what the contraindications are. Every manufacturer should also provide you with a guideline, okay, for treatment. We're not Ron Popeil. We don't set it and forget it. One
Mm-hmm.
size does not fit all. What we try to do with the National Certification Program, which we hold November 5th and 6th in Jupiter, Jackie, is we try to show the difference in the table. Now, if you spoke to Dr. Shealy and later Dr. Dyer, Vax-D originally started in a prone position. Now, according to the Nagelson study, the prone position has more increased disc pressure. Remember, what we're trying to get is decreased disc pressure. So now we turn the patient into supine, right? It's actually more in line with the normal lumbar lordotic curve. By doing that, it's actually the lowest level of disc pressure. Now, when you can decompress the disc, what's going to happen again, Jackie, is where that disc becomes swollen or bulging, you can see that what we're going to do is through inhibition, we're slowly looking to try to get that and actually form milking. And in a lot of the computers, it's called progression and regression. And a lot of the companies do that. So you need to look at the 510K. Now, remember, most manufacturers, Jackie, they have liability insurance for the table. And then no matter what table you have, you need to make sure that every year you have the machine calibrated. So if you're pulling at 50 pounds, you got to make sure that 50 pounds, 50 pounds. No different than an odometer on your car. If you're pushing the thing to 60 miles an hour, but it's going to 80 miles an hour, you have a problem. So you have to make sure your odometer works. You have to make sure your machine, whatever machine you have, is calibrated.
Okay, that's good information to know. Okay, tell me something now, too. Are all patients candidates for decompression therapy?
The question that's posed, are all patients candidates for decompression patients? And the answer is, Jackie, again, yes and no. Meaning, the D in doctor stands for detective. The R stands for results. I teach this throughout the United States. Now, if they have a bulging or herniated disc, yes, they're a candidate for decompression. But if they're younger and they don't have a bulge or herniation, no, they're not a candidate. I mean, the diagnosis will determine and the MRI will determine. Remember, listen, chiropractic, our job, a subluxation becomes a bulge and a bulge becomes a herniation. No different than in a tooth. You have a healthy tooth, a cavity sets in. If you ignore the cavity, it now becomes, the nerve gets involved, right? Which we would call sciatica. And they would do, at that point, they would do a procedure. And then if that doesn't work, then what happens, the decay continues, right? Then what happens is they'd have to remove the tooth. The beauty is with spinal decompression, okay, we can help facilitate the healing of the nerve, the healing of the muscle, and the healing of the joint. So the D, doctor, stands for how good a detective are you? Do you take the right x-rays? Do you look at the disc space? Okay, remember, a cavity will not go away on its own. A disc problem will not go away on its own. But let's prevent them from having root canals.
Now, I know you already answered this in the last question. It's kind of a trick question because then we answer again.
No question's a trick question.
What kind of patients should not use decompression? Now, you mentioned students in the last one, but I just wanted to reiterate that.
No. I mean, I think the question, you said, what kind of people should not use decompression? It's well, remember, first of all, every manufacturer should provide you with contraindications. Give you an example. Bone cancer is a contraindication. Pregnancy is a contraindication. Greater than grade 1 spondylolisthesis is a contraindication. You know, you have to know what the pregnancy is a contraindication. So we have to know what the contraindications are. And then, again, Jackie, what we have to do now is to do the proper diagnosis. Meaning, you know, and that's by doing the right exam. Do we do a Lesage test? Do we do a Bragger test? Do we do a Soto Hall test? Do we do a Fitzpatrick test? I mean, doctors, if you're a doctor, be a doctor. A D for detective and R for results. Now, if they came in, an 18-year-old guy, and he's a ball player, and he has a little strain in his neck, and you x-ray him, and the lordotic curve is healthy, and everything is healthy, then no, why would we treat them with decompression? However, if the x-ray showed decreased disc space and a loss of normal lordotic curve, and we sent them for an MRI, so, you know, it's like anything else, Jackie. If someone doesn't have high blood pressure, would you give them high blood pressure medication? It's not right for everybody. It depends on what the problem is. Doctor, be a good detective. Go back to your basics. You know, Jackie, the most beautiful thing, and I'll tell you, is, you know, chiropractic has changed my life. And it's the, you know, and I say this to everybody, Jackie, it's the greatest profession in the world, but it's not the easiest business. I mean, on the totem pole and in the world, Jackie, that we know it, we're the lowest people on the totem pole. But I'll tell you, doctors, if you can focus on the spine and you can focus on the disc and you know how to handle a sacral shear, and you'll learn these things November 5th and 6th. I promise to make you a better doctor. You'll have a 250-page manual. And I'll tell you what, doctors, if you come that weekend, I will stay there even on Sunday when it ends. After you get your 12 years, I'll answer any question anybody has, because I consider it an honor to stand on the forefront of this profession and to carry on the works of people like Dr. Alan Dyer and Dr. Norman Shirley. And I'm honored to work with the American Chiropractic Magazine that's been so supportive of me. Oh God, probably for the last 25 years. We've done so many beautiful things, Jackie. And one of the things I've always spoken to, the seminar that they did, I'm going to put pressure on the American Chiropractic family now, because they had one of the greatest programs. They held it in Panama. And for anyone that hasn't been to Panama, I think we need to send letters. I want everybody to go write a letter to the American Chiropractic and say, please bring back the seminar to Panama, and please bring Dr. Kaplan there, because I can't wait to come back. It was such a magnificent country. When you fly up in the airplane and then you see all these, beautiful buildings, it was simply spectacular. And your family couldn't have hosted everybody better. I think that's what makes the American Chiropractic special, doctors, is they're a family. This is a family business, and the family is involved, and they're caring and supportive, not just of the doctors and not just of the magazine, but of the profession. I mean, their family. I know the brothers are, treat patients, and one of your brothers is, I guess, really one of the great pioneers of decompression. So it's really an exciting time, and nobody really does a better job educationally to educate the doctors with a visual experience that the American Chiropractic does. And I commend you for that, Jackie. I really do. And that's coming from my heart.
Well, thank you. It's because of great doctors like you, Dr. Kaplan. We just get to have the honor to connect our readers with doctors like you who are still in the trenches and take the time, because that's the one thing that we always say, a lot of doctors discover all the answers out there and then they retire. So we're glad that we've got your son in practice still to keep, pulling you back into the ring too. You know what I mean?
And Dr. Bard's son now, Jackie, my partner and best friend of 35 years, Dr. Bard, his son now is in chiropractic school. I mean, and it's a very funny thing, Jackie. Think about this. I speak to so many chiropractors all over the country. A lot of them would tell their kids, don't go into this profession.
Well,
they tell them that, Jackie.
That's scary. That's scary.
Yeah,
so what is
that's the reality, Jackie. Why? It's a beautiful profession. It's tough business. But when you see people like my son and Dr. Bard's son, and he's in school now, it tells you, what do we know, doctors, that you don't know? Well, come in November, come down to Jupiter, Florida. Let me show you what you know. I guarantee you'll make more money, and I guarantee you'll walk away a better doctor.
Well, and one last thing too. Well, I don't know if it's the last thing, but let me ask again too, because I remember just sometimes people are not aware. We often talk about, we're walking the talk, a magazine for, from chiropractors for chiropractors, like you mentioned, founded by our father, who was a practicing chiropractor at the time. We currently have 2 practicing chiropractors, Dr. Joe, our editor, who was on the call earlier. His clinic is adjoining to ours. And my oldest brother, Dr. Rick Bush, out of Indiana. But I was going to say, now you also, we always say we've got skin in the game. We're in the trenches with all the chiropractors, same as you and Perry. Now you've got not only a chiropractor, because we're mentioning this about sometimes you'd seem to like rub the wrong way with the MDs. So we've got to tell even some of our authors. But then I said to even Dr. Joe, is reminding our editor here too, well, Dr. Kaplan's got another son who's an MD as well.
It's very funny, Jackie. Here he is. I have one son who graduated Parker. I have a daughter-in-law who graduated from Parker, and they practice in Wellington, Florida. My other son went to medical school, and then I'm not going to lie to you, he wanted more of a surgical residency, but he couldn't get the type of residency, and he didn't want to do. He said, "Dad, I'm not going to do general practice. I'm not going to do flu shots for a living." So he went on and he did graduate work and got his master's at Harvard University. And now he's working with genetics in a biotech company. He's worked with Novartis. But, it's funny, in November, he will be there, Jackie.
Okay.
My internist will be there. See, the bottom line is what people have to realize, Jackie, the first place people go to when they have pain or whatever is to the medical doctor. So for the chiropractor having a relationship with medical doctors. So that's why I said in November, I'm going to have a physiatrist there. My internists will be there. My son will be there who's doing research. So you have medical people. I mean, we treat the internist's wife, the radiologist. We've treated the radiologist. We treated the wife. We treated the children. The more they learn about decompression, the more they learn about chiropractic, the more they love it. But you know what, Jackie? If we don't educate them to what we do,
Right.
you know, I remember, Jackie, when I had a positive MRI, and then a few months later, I saw the radiologist, and he said, "Who did your surgery?" Because my MRI was terrible, and I said, "No, I did spinal decompression." He said, "What's that?" I said, "Well, let me send you some literature." So 3 months went by, Jackie, probably, right? And then he calls me up. He says, "Eric, I'm having back trouble. What was that decompression thing you told me about?" So I sent him the literature, never looked at it. Now I resent him the literature.
Right.
And then I came in and explained it to him. And now he's a patient. He's referred more medical doctors. I would say, Jackie, in the book we just wrote with Dr. Norman Shirley, and we have a lot of interviews from your magazine, even with Dr. Alan Dyer. You know, one of the things that we found is medical doctors, the more aware they become of chiropractic, the more they embrace what we do. We're not the Hatfields and the McCoys anymore. It's a new world.
Right.
And you know, and you know what? We can do stuff they can't do, and they can do stuff we can't do. And that's what makes for the perfect marriage.
Right.
I mean, it's really exciting. And my job has always been, Jackie, trying to build the bridge, putting medical people. And that's why in November, I have an MD there, I have an internist there, I have a physiatrist there, an anesthesiologist there, who my son, you know, has brought in, pain management, radiologists. We're doing MRIs because we want the chiropractors to know that medical people actually dig us.
Right.
Jackie, they like
They're
us.
not
now.
the enemy. They're not the enemy.
They like us. You know what? How exciting. You like me. I love that you like me. I mean, it's so exciting when an MD sends his wife in and they see, you know, I've been a doctor for the Miami Heat. I worked with the Clinton organization. I was an advisor to the President's Council. I worked with the Trump family. So I've worked on both sides of the political spectrum. And what I've learned, Jackie, is the more they learn about what we do, the more excited. I mean, we did a piece with your magazine, which is very gracious of you, when Donald Trump was president, how he brought veterans. Every veterans hospital before Donald Trump did not have a chiropractor. Now he signed into law. Every veterans hospital has to have at least 2 chiropractors on staff. You see, doctors, we're growing. My goal now is to get better reimbursement through Medicare. Medicare does not even pay us for x-rays. A physical therapist gets paid more for Medicare than chiropractors do. Well, you know what? The DR for me now stands for demand respect. We need to stand up and fight for our rights, Jackie, as a profession. And that's what I do. And that's what motivates me. And let me tell you something. And I know your brothers. I know Joe, what a good heart, what a caring doctor, what a loving. And your brother actually was one of the pioneers of decompression. I mean, your brother,
the
Rick,
the third.
Rick Bush in Indiana was one of them. Listen, he took, I will tell you, he's probably, when it comes to this, he's the king of Indiana. And I'm proud to call him my friend. And Rick, if you hear this, listen, you're my hero. And you might even be younger than me, and you're still my hero.
Well, let me check a couple things because I wanted to go back over. You had hit on some good points about what kind of research has been done for decompression therapy.
You know, when we talk about research, Jackie, that's my baby because, and that's what we're going to teach November 5th and 6th in Nashville because it's a 12 CEU program. You know, it really started, you know, Alan Dyer, who was the Minister of Healthcare. So you know what a brilliant guy he was. Not only was he an MD, PhD, as is Norman Shirley, an MD, PhD, but Dr. Dyer really was on the forefront. Then I mean, you know, Shirley became like the godfather because the two of them started working together. You know, but what he did, one of the first major studies he did was the Ramos and Martin study, and they showed on the video fluoroscopy that you could create negative disc pressure. Up to 160. And when you can do that, Jackie, then you create what we call imbibition and actually have retraction. That was followed up by the Ironman study, the Apfel study, the Ornell study. Don't let me get started. The Shirley study, the Shirley-Kalady study, the Shirley-Wasserman study, the Shirley-Bergmeyer study. But one of the great studies also was by Dennis McClure that showed of 500 pre-surgical cases, Jackie, pre-surgical, meaning they've already recommended surgery. He had up to a 92% success rate and 86 to 90% even a year later. Now, when you look online, and doctors, if you doubt me, go look up failed back surgery syndrome. I mean, failed back surgery syndrome, epidemic proportions. Now the success rate is 50 to 60%. After that, it drops in half, and after that, it drops in half. So you take Tiger Woods, who had 4 microdiscectomies. Now, doctors, if you don't know, a microdiscectomy, and we're going to go through this actually in November, is they cut off the material of the disc. But what happens, doctors, if you keep cutting it and cutting it and cutting it, what happens, doctors, is now you don't have any disc space. So that space that we see here, doctor, that's going to go away. So here you have a good disc space. And now look at that. You have no disc space. So you can't keep removing that gel because that gel is the shock absorber. And I think that the beauty of spinal decompression is in a prone position, we according to the NAGMA study, we can create negative disc pressure, and negative disc pressure will rehydrate the disc. It's almost like milking the disc. You bring, and that's why they go from most of the major softwares, Jackie, they do a thing called progression regression, where it actually milks the disc. North American Medical even goes a step further, and they use oscillation. VAXD does a logarithmic index. So the software of the equipment is very important. And contact your manufacturer, look at the 510K, find out what the software is, and be a master of it.
Wow. Very good. Okay, last thing I'm going to ask one last time.
See, this wasn't all philosophy. Well, you didn't know how smart I was, did you? I know I'm cute, but life to be cute and smart, Jackie, that's very hard to do.
Total package. Okay.
Good for you.
Okay, now I'm going to ask this one last time. Is there ever a time when back surgery is indicated?
You know, Jackie just asked me the most difficult question. Is there ever a time when back surgery indicated? And the answer is yes. You know, if Jackie, you know, if the front of the car went out of alignment, what would happen to tires? They'd wear, right? And if the metal was showing, what does it mean? They're almost gone. Well, if it blows out, if the disc herniates and sequesters, and then the person has loss of bowel function, they need surgery. Foot drop, they need surgery. Loss of bowel, they need surgery. I mean, there are items where, you know, see, because once the disc sequesters and you have that disc material everywhere, the answer is yes. But you know what, Jackie? According to the DIO study out of Washington State University, that's really a small amount of the major surgeries that we have. So if we as chiropractors can step up, matter of fact, you know, I think it was Mark Student who I read about in your magazine, showed me a study, and he showed that if we could as chiropractors step in, we could probably save this country billions of dollars. And us as surgeons, now I'm actually doing some work with Mark and trying to do that, because, you know, that's what we need to do as a profession, doctors. We can't just line our own pockets. I can thank God that, you know, I do this for the passion of helping doctors. But I think, you know, I think we as a profession need to stand up and take our rightful place. So yes, sometimes, Jackie, they do need surgery, but you know what? Surgery happens way too often.
Right.
And I think that we can help eliminate. I mean, if you read, you know, so many studies from DIO that came out, even John Hopkins, the cost of surgery keeps escalating. Newsweek did an article on it, that it went up on one person. They had so many surgeries, they ended up with hospitals, 270,000. We become a very cost-effective profession by helping people prevent surgery. And with studies like the McClure study, 92% success rate. Shirley Bergmeyer, 86% success rate. Dr. Leslie from the Mayo Clinic, 86% success rate. Well, you know what, Jackie? If we can reduce surgery by 86% in our country, we've made a difference that could change the world, and it'll change the face of the future of chiropractic.
Amazing. Well, that's great news. And I was going to say one last thing too, because I remember that most people are looking for the drugs first, where it's supposed to be chiropractic first, then the drugs, and surgery last. But for some reason, the patients seem to be oriented to going to, you know, the drugs first, surgery second, and chiropractic last. Decompression, at least fortunately, seems to be very successful even in failed back surgeries. So that's at least encouraging.
You know, one of the things, Jackie, one of the things that I try to do with all my doctors in Disc Centers of America, you know, I think with the reason we're the largest company for disc-related injury, and, you know, we're in over 40 states now, is because one of the things that we try to do is we embrace the medical doctors, meaning
Mm-hmm.
many times, Jackie, when a person is in pain,
Mm-hmm.
the first thing they do is they go to their general practitioner, their primary doctor.
Mm-hmm.
Now remember, primary doctor, they have limited tools.
Right.
I mean, you could be an architect, but if you're not a carpenter, an electrician, and a plumber, you're not going to build a building.
Mhm.
I mean, there's a need for what we do and our expertise. And what's happened is, we try to educate right away, Jackie, the
Mhm.
community of what we do and how we become allies. Because let me tell you something, medical doctors don't want to prescribe opioids.
Mm-mm.
They know there's an opioid problem. They know it's a class type of medication
Mhm.
that they have problems prescribing,
Mhm.
and they don't want people coming in and asking them for opioids all the
Mhm.
time. So you know what, Jackie, this is a time for us because we can reduce the level of opioid
Mhm.
usage in our country. We can reduce the levels of surgery in our country
Mhm.
by also educating them what we do and by bringing forth the
Mhm.
studies like from the Mayo Clinic, the
Mhm.
Leslie study, the Stanford study,
Mhm.
you know, and what makes this so powerful, Jackie, is people are just becoming aware. The medical people are just becoming aware,
Mhm.
and that's good
Mhm.
for the profession.
Mhm.
We're not just here, doctors, to make money. If you're always chasing money, then you're a slave. If
Mhm.
you could teach money how to chase you, you become a master. Be great at what you do.
Mhm.
Because I said, if they go to the medical doctor first, now they go to the MD, he doesn't want to prescribe drugs, but they're in pain.
Mhm.
So we utilize things like laser, class 3, class 4. We utilize electroanalgesia,
Mhm.
which acts as a nerve block. And, there's a very big difference. TENS unit goes at 100 pulses per second. Basic EMS goes at 10,000 pulses, 1,000 pulses per second. Electroanalgesia goes at 10,000 pulses per second.
Mhm.
So what it does, it creates a nerve block within the patient. So imagine, doctors, we can give them pain relief without drugs and without surgery.
Mhm.
And isn't that what we said? Chiropractic first, drug second, surgery last.
That's
But remember this, doctors, I've changed the paradigm. Chiropractic is not a philosophy, an art, and a science. That's not, philosophy is subjective. Chiropractic is a science.
Mhm.
This has been proven over and over again by Dr. Sue.
Mhm.
We do have a philosophy that we embrace, and the philosophy, doctor, is not just a hard bone on a soft nerve. It's about helping and healing people.
Mhm.
We're the lovers of healthcare. We're the givers of healthcare. We're the servers of healthcare. My philosophy is love every patient.
Mhm.
Be a hugger, not a tugger. And then, so it's a science.
Mhm.
Chiropractic is not a philosophy, art, and a science. It's a science that has an art, and we understand the philosophy of Winston Churchill said, "You make a living by what you get,
Mhm.
you make a life by what you give." And it's your job, doctor, to give to your patients, to give them hope.
Mhm.
Hope. What a powerful word, Dr. Hope is. Like I said, DISC stands for the acronym. DISC is Specialized Chiropractic. And if you want to learn how to become a specialist in your profession, November 5th and 6th, Trump
Mhm.
National, Jupiter, Florida. Get there,
Mhm.
get 12 CEUs, and be treated like a doctor.
Mhm.
Be treated like a doctor amongst medical professionals and chiropractic professionals from all over the United States, and learn what it's like to take respect, to stand up tall,
Mhm.
and know that as a chiropractor, you can prevent people from drugs and surgery,
Mhm.
that you can help reduce the opioid epidemic. Wow.
Mhm.
This is exciting times for chiropractic, Jackie. I'm excited. I'm excited sitting here with you.
I'm just sitting here thinking too about what percentage of chiropractors gravitate to decompression, the safety of it, to dealing because I would imagine that maybe they would be scared to deal with these kind of conditions because what's the liability? What is the risk? You know what I mean? I mean, what kind of doctors do you find? One, can all chiropractors do this kind of work, or should they have, you know what I mean, in their stage of growth? What do you find?
You know, First of all, Jackie, I've been very lucky. I've donated tables already now to Parker University.
Hmm.
I've donated a table to Life University
Hmm.
because it begins with the student. Listen, we as chiropractors, what do we deal with? We deal with bone, we deal with nerve, we deal with disc every day. Now, I'll give you an example, Jackie. So, if somebody has a herniated and bulging disc, something as simple as side posture is more contraindicated than spinal decompression.
Okay.
You know, when I worked with one of the people from NCMIC, what they love is the research studies, and they love the areas of that. Because if somebody comes in, Jackie, let's
Hmm.
say that you came to my office, and And what do you weigh now? 100 pounds, 110 pounds? I mean,
Maybe,
you know,
maybe there
you're a little thing. You're a tiny little thing, and if you get someone and they start like pounding you, and all of a sudden now, Jackie, you go and you have an MRI, and now they say, oh, you have a herniated disc. Now they're going to say, well, I never herniated disc when I went to the chiropractor.
Mm-hmm.
So that's why the D stands for detective. We have to do a better job in diagnosing them. And then we have to treat them. If they have a subluxation, we treat them one way.
Mm-hmm.
If they have a bulge, we treat them another way. And if we have a herniation, treat them another way.
Mm-hmm.
And that's what we talk about November 5th and 6th, National Certification, because, one size does not fit all, Jackie,
Mm-hmm.
right? When everyone doesn't get the same program.
Right.
I'm not going to treat you. One of the people that will be there is NFL legend. He was captain of both the Bengals and Chiefs, wearing a Super Bowl ring, is Dwayne Clemens.
Mm-hmm.
Dwayne was the captain of the Bengals and Chiefs. He now coaches
Mm-hmm.
with them. And Dwayne is 6'5", 280 pounds, and he's all muscle.
Mm-hmm.
I'm not going to treat him with the same power
Right.
that I would you.
Right.
And no different with the machines, Jackie. You have to understand how to use the machines, and that's why you need to be certified. Right. Because one of the things an attorney will say to you in a malpractice case, were you certified? Who taught you? And what are their qualifications? Well, you'll be nationally certified from Life University, November 5th and 6th. It'll be a life-changing event, and you'll sleep better at night and be a better chiropractor. I guarantee it.
That's amazing, and especially with Life University as a partner on that as well too. That speaks volumes for chiropractors, I would say.
Well, Jackie, they're not a partner, because I donate my time and I donate money and I donate at a table. All the money goes to Life University. Our goal is that we can get them to spend some of that money on research, right. But 100% of all the money goes to Life University. And then we'll pay for the lunch, and we'll pay for there'll be a cocktail hour and cigars, and Dr. Bard and I pay for that, because we think there should be a party, and we call it the party of chiropractic.
I agree.
We want to bring doctors together and not have, like, after they sign out, oh, I can't wait to get out of here. Oh. We want them to interact.
Right.
We want fellowship.
For sure.
It's one of the lines I'm most famous for, Jackie, is I said, chiropractors circle the wagons and shoot at each other.
Right.
I mean, we become a profession. We don't refer to each other. We don't. But you know what? We're trying to create a fellowship, because you know what? That's what we can do. We can make a difference. And we do that by providing hope, Jackie. There's hope for our future. There's hope for our profession. Remember, the middle class of chiropractic is dwindling.
Right.
People are either making money. Some states, the insurance company, Jackies, have gone, insurance reimbursement has gone to this. PTs get paid better.
Right.
Well, we need to fight a little.
Right.
But we also need to have the ammunition and the research and the support of the medical community. Since the Wilkes case, Jackie, where does that move the profession forward? Right. We're the lowest reimbursement of all the centuries. It embarrasses me, Jackie, to know that a PT gets paid better for a back problem than a chiropractor. And I'm trying to fight that. And when I was with the 45th President of the United States, and we're talking, and I told them, if you get elected, I want to get Medicare reimbursement for chiropractors. I want them to get paid for x-rays. And how could they not pay us for x-rays and exams and yet expect us to be good doctors?
Right.
You know what? But politically, Jackie, we have to make inroads. And listen, I don't care if they're Democrat or Republican. Let me tell you, my first vote in life, Jackie, goes to chiropractic.
Right.
That's the profession that gave me the life that it is. And I vote for chiropractic first. Okay, politics second.
Right.
That's the way it has to be.
Awesome. Well, good deal. Well, Dr. Kaplan, I'm trying to think if there's anything else that we haven't touched on yet today. I know that we can always get you back on for our listeners. I'm going to direct them. Every month, we're going to be directing them so that they can listen to you here, and any other updates that we might want to connect on following this as well.
Well, Jackie, I thought today was a very good meeting. Honestly, I say that, subjectively, but I thought we also got a lot of information out. And I think, Jackie, that every listener has to answer this question: why? Why should they choose you as a doctor? Why are you the person that I would trust my wife to, or Jackie Bush to, if she had back problems? Why you? We know who you are. We know what you do, but why you? If you come in November, I'll answer that question for you. You know why? Because you'll be the best at what you do. You know why? Because you'll know how to treat disc injuries. You know why? Because you'll be able to better communicate with the personal injury attorneys. You know why? Because you'll be better able to communicate with the insurance companies. You know why? You'll be able to better communicate with veterans and the Veterans Administrator. You know why? because I'll take you from good to great.
Mhm.
I'm Eric Kaplan, telling everybody from the American Chiropractic, thank you.
Thank you, Dr. Kaplan. Thank you so much for listening, and thank you for all our listeners who are listening in as well.